For women with gestational diabetes, exercise is a crucial treatment option for managing blood sugar during this time. In this video, I'm going to show you how to reduce the risks of gestational diabetes and its complications, and how to start exercising safely during pregnancy. I'm Dr. Elise Brown, and I'm a scientist who studies how exercise can help prevent and slow the progression of diabetes. Given the lack of certainty when it comes to balancing the risks versus the benefits of exercise during pregnancy, many women, including those with gestational diabetes, may completely avoid exercise altogether during this critical development period. Gestational diabetes is the inability of the mother to tolerate glucose or sugar, and it can lead to poor pregnancy outcomes like preterm delivery, the need for a cesarean section, a baby that grows faster and larger in the womb, blood vessel complications of the baby along with high insulin levels, and in worst case scenarios, even death. After pregnancy, the mother is more at risk for developing type 2 diabetes and high blood pressure. Thankfully, a lot of the complications that come along with gestational diabetes can be reduced through exercise. Exercise during pregnancy has a number of beneficial effects on the baby. Some of these benefits include a better cardiovascular response to exercise by the mother, more amniotic fluid, which is important for the baby's growth, and enhanced brain development of the baby. Exercising before and during pregnancy can greatly reduce the risk of developing gestational diabetes. If you're planning on becoming pregnant, exercising for up to a year before you actually become pregnant can reduce the risk of developing gestational diabetes by 76%. A recent meta-analysis that included 54 randomized controlled trials found that exercise was 39% more effective in reducing the chances of developing gestational diabetes compared to standard prenatal care. The exercise programs that were most effective were started in the first trimester. They included light to moderate intensities, and they were supervised. Now, the first trimester may not be feasible for a lot of women because of all the discomforts that come along with this pregnancy period, like morning sickness, nausea, and fatigue. The most important thing is that you start exercising as soon as you comfortably can, even if that means waiting until the second trimester. Even though it's most effective to start exercising before you get pregnant, exercising with gestational diabetes is safe in most cases, but you should speak with your doctor before you start an exercise program. The main goals of gestational diabetes care are managing blood sugar levels and improving pregnancy outcomes. The first line of defense with this condition is the combination of an appropriate diet with exercise. Having an appropriate diet in place helps to prevent having high blood sugar levels in the first place, and exercise can help to clear that extra sugar out of the blood. The current recommendations by the American Diabetes Association suggest that women with gestational diabetes should be exercising between 20 to 30 minutes a day, most if not all days of the week, at a moderate intensity. Now, this can include weight training or traditional cardio like fast walking, and higher intensities may help to prevent weight gain during pregnancy. Exercise guidelines for women with gestational diabetes were published by Padayachee and Coombes back in 2015 based on the current scientific evidence at that time. Now, different types of exercises can be done for gestational diabetes, like yoga, strength training, cardio, and recreational activities like going for a hike. There are some types of activities that are best to be avoided, however. Avoid any sports or activities that could involve falling or contact, like basketball or rugby. Avoid scuba diving, avoid standing on your feet for long periods throughout the day without moving, and also after the first trimester, avoid any exercises that involve lying on your back. Both strength training and cardio are effective in managing blood sugar levels, and the effects are going to be more pronounced whenever you have an exercise program that combines both. Whenever you're doing cardio, consider activities like walking, jogging, an exercise bike, climbing stairs, rowing, or going for a swim. For strength training, this can be done using resistance bands. It can be done using your own body weight, like push-ups, as well as free weights, like using dumbbells. Now, there have only been a few studies that have actually looked at strength training in gestational diabetes, and none of the studies to date have reported any unfavorable events related to exercise, and they included intensities that ranged anywhere from light to vigorous. No matter what type of exercise that you choose, make sure that you start the exercise session off with a 5 to 10 minute warm-up. This is going to include light to moderate intensity activities that mimic whatever exercises you're planning on doing during the exercise session. And finish the exercise session off with a 5 to 10 minute cool down. So this could include light intensity movements along with stretching. For cardio, you want to try to build up to 30 minutes a day, 4 days a week at a moderate intensity. For strength training, you want to train on at least 2 days a week on non-consecutive days, working all major muscle groups at a moderate intensity with 3 sets of 8 to 15 reps. While these exercise recommendations, they may seem a bit daunting at first, it's important that you ease into exercise and then you just build from there. For example, you could start walking for 15 minutes within your first week, and then the next week you could build it up to 20 to 25 minutes. And similarly for strength training, during your first week, you may only want to do 1 set of each exercise at a moderate intensity, and then your second week that you come in, you would build that up to 2 sets of each exercise. Now, there are some warning signs that would indicate that you need to stop exercising if these conditions are present. So this is going to include vaginal bleeding, leaking of amniotic fluid, preterm labor, decreased activity of the baby in the womb, dizziness, headache, chest pain, muscle weakness, pain in the calf, or feeling fatigue without exerting yourself. If you're pregnant, you're not currently exercising, talk to your doctor about safely starting an exercise program. Exercise can greatly reduce the risks of gestational diabetes and improve pregnancy outcomes. Thank you for watching.